This solution is used to treat high blood calcium levels that may occur with cancer. It is also used with cancer chemotherapy to treat bone problems that may occur with multiple myeloma and other types of cancer that have spread to the bones. Zoledronic acid belongs to a class of drugs known as bisphosphonates. It lowers high blood calcium levels by reducing the amount of calcium released from your bones into your blood. It also works by slowing the breakdown of your bones by cancer to prevent bone fractures. It is usually given by a healthcare professional in a hospital or clinic setting. The dosage and timing of this medication will be determined by your healthcare provider. Before receiving zoledronic acid, it's important to read the patient information leaflet from your pharmacist. This medication is given by injection into a vein as directed by your doctor, usually over at least 15 minutes. The dosage is based on your medical condition and response to treatment. If you are giving this medication to yourself at home, it's essential to learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. It's important to avoid mixing zoledronic acid with 4 fluids that have calcium in them. For the treatment of high blood calcium levels, fluids are usually given through a vein before you receive this medication. To decrease the chance of kidney problems, drink plenty of fluids during treatment unless otherwise directed by your doctor. It takes at least 7 days after a dose to get the full benefit of this drug. The dose may need to be repeated depending on your blood calcium levels. For the treatment of multiple myeloma and bone problems caused by the spread of cancer, this medication is given as directed by your doctor, usually every 3 to 4 weeks. You may also be instructed to take calcium and vitamin D supplements each day. Some common side effects of zoledronic acid solution, intravenous piggyback, include dizziness, headache, tiredness, or flu-like symptoms such as fever, chills, muscle or joint aches. If you experience any of these, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor right away if you notice any of the following serious side effects: increased or severe bone, joint, or muscle pain, new or unusual hip, thigh, or groin pain, jaw or ear pain, eye or vision problems, numbness or tingling, muscle spasms, or irregular heartbeat. Additionally, seek medical help immediately if you experience signs of kidney problems or seizures. Although rare, it's important to be aware of the possibility of a serious allergic reaction to this drug. Seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting treatment with zoledronic acid, it's important to let your doctor or pharmacist know if you have any allergies, especially to other bisphosphonates, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. It's also important to disclose your medical history, especially if you have kidney problems, dehydration, or aspirin-sensitive asthma. Additionally, some people using zoledronic acid may experience serious jawbone problems, so your doctor should check your mouth before starting this medication. Be sure to inform your dentist that you are using this medication before any dental work, and make sure to have regular dental exams and practice good oral hygiene. Before undergoing any surgery, especially dental procedures, be sure to inform your doctor and dentist about your use of this medication and any other products you may be using. Zoledronic acid may cause dizziness, and using alcohol or marijuana can exacerbate this effect. It's important to avoid driving, using machinery, or any activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages is also advised, and if you are using marijuana, be sure to discuss this with your doctor. Older adults may be at greater risk for kidney problems while using this drug, so it's important to monitor this closely. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as zoledronic acid may stay in your body for many years and could harm an unborn baby. Using reliable forms of birth control during treatment and after the last dose is important, and if you become pregnant, be sure to speak with your doctor right away about the risks and benefits of this medication. It is unknown if this drug passes into breast milk, so breastfeeding is not recommended while using this medication and after stopping treatment. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking zoledronic acid solution, intravenous piggyback. Certain medications may change how this drug works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, be cautious of using calcium-containing fluids with this medication, as it may interact with zoledronic acid solution, intravenous piggyback. It's also important to note that there is another zoledronic acid product used to prevent or treat bone loss, osteoporosis, and it should not be used together with this medication. When taking zoledronic acid solution, intravenous piggyback, it's important to follow the dosage recommended by your doctor and to take it at the optimal time for the best results. Always consult with your healthcare provider for the most appropriate dosage and timing for your individual needs. If someone has taken too much zoledronic acid solution, intravenous piggyback and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include changes in urine output, muscle spasms, weakness, changes in mental/mood, irregular heartbeat, and seizures. Before starting zoledronic acid solution, intravenous piggyback, your doctor will conduct lab and/or medical tests to check levels of calcium and other blood minerals, as well as kidney function. It's important to attend all your medical and lab appointments. If you have any concerns or need more details, consult your doctor. Make sure to take each dose of zoledronic acid solution, intravenous piggyback on time as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately to determine a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. Do not dispose of this product by flushing it down the toilet or pouring it down the drain unless instructed to do so. Make sure to properly discard the medication when it is expired or no longer needed. Your pharmacist or local waste disposal company can provide guidance on the proper disposal of this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.